Hi everyone, the name is Nat, and welcome back to another episode of the Exceptional Individuals Exceptional Podcast, where we explore the power of neurodivergent minds. Today, I am joined by the amazing Dr. Ilona Singer, a clinical psychologist, a service user, and a fierce advocate for those often forgotten Ds of neurodiversity: dyslexia, dyspraxia, dyscalculia, dysgraphia, and Ireland syndrome. Today, we're going to be unpacking some hidden barriers in psychology, the cost of unmasking, neurodivergence and gender identity, and also what inclusion really looks like when you live it. So, without any further delay, welcome. Good to have you today.
Hiya. Thanks for
Thanks.
that amazing introduction.
Honestly, it's all yours. So let's just kick it off. I'd love to know in your own words a bit about your kind of own story and a bit about who you are.
Okay. I'm a sort of a multiply neurodivergent person. I think my most recent up-to-date diagnosis was dyslexia, dyspraxia, dyscalculia, and Erland's to be explored. Really, there's definitely something very different going on about my visual processing. I'm a clinical psychologist. I actually work in gender identity now, having worked in community mental health teams for the bulk of my career. It wasn't my original career because, in fact, I didn't really have an original career because I set out in a very kind of windy way, as a lot of neurodivergent people do, thinking, oh, I'm good at this and I'm really not very good at this. And I don't know how that all fits together. So I was always interested in psychology. I didn't do it at A level. That was rare in my day anyway, but I didn't do it. I didn't consider doing it at university because I looked and saw that there were stats, and I have massive maths anxiety and dyscalculia. And I was like, oh, how is something that's primarily about helping people and understanding people full of all of this maths? I didn't really get it and really objected to it at the time, but also knew I would be rubbish at that part of things. My original degree was sociology and philosophy, which has helped, has some stuff. Oh, just getting an email notification. Sorry. Yeah, my original degree was sociology and philosophy, and that's helped lend us more critical eye to mental health systems, to marginality, to maybe the kind of neurodiversity movement and things like that. I think I found myself quite unemployable after it. To be honest, I was still caught in that kind of thing where I was quite intellectually quite good, but all the sort of graduate employers wanted these all singing, all dancing, all rounders who spoke lots of languages and drove and were numerate and wanted to move city all the time and pick up tons of things. And I just wasn't that. So I found myself sinking into kind of retail and things like that. And as any dyspraxic person knows, that's really not usually where you belong. And then as a result of that, my mental health deteriorated as a result, perhaps, of not finding my way in the world and some difficult relationships, things like that. Became a mental health service user, thought there really isn't a very much of an understanding of what I've been through here or of my neurodivergence anyway. And then thought, you know what, I could be a clinical psychologist. I could start again. Why let this mass anxiety ruin stuff for me? And then started my career again, basically did a psych degree with the Open University, and then did voluntary work, worked as an assistant psychologist, and then did my doctorate, and then worked on CMHTs, community mental health teams, and now in gender. So that's my little potted history.
Thank you so much for your honesty on that. And I think you have a very interesting perspective from being someone who supports people, but also someone who has received support in the past. And you have mentioned that your journey wasn't linear by any means.
Yeah.
And I'm curious to know that while you have spoken about some of the challenges, what was the kind of key turning point for you? And what was the area that kind of hindered you the most?
The area that's hindered me the absolute most is not being able to drive. And
Mhm.
there is one thing I would like people to take away from this today, is that absolutely stop asking people to drive across jobs in the health and social care sector. What you need to do is describe what travel is going to be required and let the person self-select as to whether they can do that, which is how you treat any capacitous person, really.
Yeah.
That's been an enormous barrier. And I felt quite angry about that because nothing actually told me. When you look up what does it take to become a clinical psychologist, it'll say things like, oh, it's really competitive, you need a good degree, blah, blah, blah. went off, worked like a maniac, got my first, tick, 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 and then suddenly found that getting jobs that was in there. And then often when I got to know the person who'd actually got that job, they'd go, oh, yeah, you have to go somewhere once a week or whatever. I think, why have I been preemptively excluded? Which is the same for some of the training courses in clinical psychology. And it's completely ableist and completely wrong. So that's been the main thing. The not being any good at stats has also been quite a problem. I was really lucky because my Open University degree, which was the only way I could have done this because I had a child by that point, was quite social psychological, really interesting, really good course, not particularly statsy. And then I had to look for a clinical psychology doctorate where I could avoid that. And that was a pain because my local one was Manchester and they had basically a stats exam. I inquired and said, I've got dyscalculia. Will any allowances be made for that if I were to get on that course? And it was like, no.
Oh.
So, I had to do mine in a different city, which then along with commuting on public transport and having a small child was really quite difficult. So yeah, there's a lot of intersectionality with things sometimes. Sometimes I think it's the fact that I'm bad at stats and I can't drive that sort of come together in this horrible toxic mix. But in terms of more positive turning points, it might sound really a bit arrogant. When I was a mental health service user, and I still am, by the way, when I was in the sort of deepness, really bad depression and I can't get a job and I'm poor and I'm having terrible relationships and what's going on for me. I remember seeing professionals, seeing clinical psychologists about my experiences and about my depression and them just not really having that holistic understanding. I remember coming away and thinking, oh, I've just got dysfunctional thoughts, rather than having that whole life context and actually thinking perhaps arrogantly, I could do better. If I was working with someone, I'd be a lot more validating about what they've been through and I'd be a lot more curious. Why did they find, university really easy and then couldn't hold down low-level jobs? What's going on here? Why are they really articulate, but they're really struggling with life? I would have that natural curiosity about it as part of the puzzle of that person. Yeah, some of it was thinking, I could contribute to this and I could do better.
I think that's a very positive way of looking at it when you've experienced a flawed system and knowing that it can and should and will be better. And I know when going back to, I suppose, some of your challenges, you mentioned that you asked for support with your dyscalculia, which is difficulties with mathematics in certain areas and statistics, yet they said, yeah, can't give you any support. So this kind of nicely brings me on to the next question about why. You mentioned forgotten Ds such as dyspraxia, dyscalculia, dyslexia, Ireland syndrome, but why are they still so incredibly marginalized? Is there a reason that they don't get as much kind of a space as, say, ADHD or autism, in your opinion?
I really don't know. And it really puzzles me. And I'm very disappointed, to be honest, because when all this conversation recently opened up about neurodiversity, I was really happy about that. I thought it's a bit late in my life. I'm in my 50s. I wish it had been so when I was in my 20s, but that's progress and that's the way society works sometimes. But I'm very disappointed to see it focused almost 95% on autism and ADHD, even when we have lots of shared commonalities. So there's a sort of a trend with ADHD, I think, to include things that I think are more general neurodiversity things. Like, for sure, I certainly have executive dysfunction. I certainly have rejection associative dysphoria, but I don't tick the boxes for ADHD. And that will be the same for lots of neurodiverse people. So there's a sort of claiming of traits as part of a specific discrete diagnostic cluster, if you like, that might actually, it makes sense that neurodiverse people in general would have rejection sensitivity. We suffer more rejection. And so there's that. And then, yeah, I don't know. I sometimes feel like it's not seen as sexy or interesting. And I don't really know why that is. We have a lot of media stereotypes about autism, often quite inaccurate, but people are interested in it. Whereas with dyspraxia, there is a weird tendency to go, oh, that just means you're clumsy, to reduce it.
Yeah.
And actually, there's recent research at the University of Surrey that shows that dyspraxia is far more prevalent than autism, like loads more prevalent. Obviously, there are lots of people who have both, or traits of both, or whatever. It's meant to be about as some prevalence studies at the University of Surrey have shown it's about as prevalent as ADHD, and both are a lot more prevalent than autism. So why are we so behind with it? It's chronically under-researched, underdiagnosed and unsupported, isn't it? And there's also that assumption that people grow out of it as well. It was very visible when I was a child. And when I was a child, I was told I've got clumsy child syndrome. Nothing was done about it, but it was very visible because I couldn't, even the way that I walked wasn't kind of normal for what everybody knows. I think like quite a lot. I couldn't join in games and PE and whatever. And it's less visible now, partly because I mask, partly because I avoid. And also those things aren't compulsory in the same way, but that doesn't mean that it's gone away. Your original question was, why there's not so much interest in it. And I'm really puzzled as to why. And I hope maybe people watch this and think, it's quite intellectually interesting, isn't it? Something that
I do think you can stick pretty well when it's just not as sexy. The only thing I can really say to that is where autism and ADHD are typically labeled as developmental disorders, even though they all are, things like dyslexia, dyspraxia are specific learning difficulties. So where one officially affects all areas of life, the Ds only, they set certain particular areas, but obviously we know that these areas,
that's all.
I suppose because they seem more black and white, it makes them less interesting. Where I think because autism is a spectrum, that's very mysterious. What does that even mean? So I think there is like a curiosity to it. People are always been fascinated by the other. And while autism and ADHD are technically hidden disabilities, I would say, let's be honest, they're not that hidden. It's very obvious. Whereas like dyslexia, Ireland syndrome, dyspraxia, dyscalculia, they can definitely hide under the radar. Until someone is in a particular scenario.
And I think to return to your point, I think it is probably all encompassing in the way that the other neurodiversities are. I just think we don't know enough about it. I think I can only answer for myself, but I think the whole way that I process the world is very different than a neurotypical person. And it impacts in so many areas. And I would really put it quite central to my life and how I organize myself and who I am. It doesn't feel like a discrete thing. I suppose if somebody maybe just had one form of neurodiversity and it just related to one thing, but even something like dyscalculia, you could go, that just relates to numbers, but it doesn't. It relates to quantities when you're trying to cook a meal, or distance when someone says how far away something is, or...
Ultimately, these are just labels that we have to certain traits. They're not like a biological mark. So that's why I think putting too much emphasis on a particular manufactured identity isn't always the best way.
I do also wonder if there's some good old-fashioned sexism as well. Autism gives a lot more attention because until very recently, we thought it primarily affected males.
There's sexism, there's even probably baked in racism. All the groups are very much part of how we have always diagnosed people.
Super society, can we?
You mentioned quite a few things that I really resonated with as someone who also has dyslexia and dyspraxia. Kind of thing about driving really hit home to me. And honestly, it's a massive sticking point in society. So you said things like driving, statistical fluency, they are so much a part of clinical psychology. Maybe isn't advertised when you go into it. I'm curious to know that. What do you think happens when we are not more inclusive of these areas in psychology? Is there any kind of repercussions, or is it just an inconvenience to yourself?
I think what I've really noticed is when I qualified, and it was by hook and by crook, really, I took a very windy route, and I really had a lot of trouble on my training course to do with neurodiversity, and got through skin and my teeth. Really did genuinely think these difficulties may well impact my employment hereafter, and they have in some odd ways, but actually not in the fundamentals of it. So there has been absolutely point blank no statistics in the 10 jobs I've had since I've qualified, other than perhaps percentages or something really 1 in 4 people might have anxiety. Do you know what I mean? At that kind of level, no numbers really whatsoever. I can score a questionnaire. The driving thing has come up because of it's an expectation from others. It has not really the practical hindrance of it is dwarfed by the fact that other people are regarding it as some kind of stand-in for a functional adult and therefore excluding people because of their own prejudices or liking to be.
Do you actively avoid roles that require those things, or do you find they are more likely to do adjustments?
I avoid roles that require sort of advanced numeracy, but it's hard because a lot of
Yeah.
things put that in and then it's not there.
Yeah.
I would like job descriptions and person specs to be a lot more honest. I'm always really careful in ones that I preside over to think, what do we actually need the person to do here? And what isn't? And are there any of those things exclusionary? Do certain neurotypes or sectors of the population have access to getting that? Yeah. What was your question? Sorry, Nat.
Oh, that's okay. I took it off. It was,
Is there, what do we lose out, wasn't it?
actually, I suppose the next question will nicely bring this in, because I think the question was that do you avoid roles because they have certain things in which are not your strengths, or do you find that people are more likely to adapt? You responded by saying, I just have to avoid them. However, you can't escape a lot of them. Sometimes
Yeah.
there anyway. And then
Yeah.
push this on a little bit too. If you have to do them anyway, and they're things that your brain naturally really struggles with, ultimately it's going to lead to burnout. So I'm curious to know, what does that kind of burnout or masking look like in your roles?
Yeah, I think to answer the previous question, I think sometimes I avoid and sometimes I challenge. So with the driving thing, I quite often now have got to a point where I will challenge it and I'll go, look, under the Equalities Act, what is the reasonable adjustment you'd make about this? Why is this in here? It's not a core thing of the role. Made a lot of enemies that way, unfortunately. But sometimes it works. And also, if there is a travel requirement, I'll use access to work. I will use a cab. I will walk, whatever, get a bus. Yeah. See, what does masking look like? And yeah, it is hard, actually. Certainly when I was going through training, there was a lot of times when I was judged for things to do with my neurodiversity that were read as not competent. I remember in one placement being told I was disorganized. And I said, oh, can you give me some examples of how I'm disorganized? They said, well, you forget door codes. And that was true. I was forgetting door codes because they were about 8 digits long and I have dyscalculia. So yeah, I was. And they said, oh, your stuff, you always bring a lot of stuff and it's in the room. And I said, oh, where do other trainees store their stuff? And they said, in their cars. And I said, well, I don't have a car. So, the stuff I'm required to bring for placement, I need to have in the room that you've allocated me. And I'm forgetting door codes because asking me to hold an 8-digit number that keeps changing is really hard for me. So sometimes there's this odd I think people have pointed out sometimes the racism in this kind of idea of professionalism, that a professional person is seen as white, but I think a professional person is also seen as neurotypical.
Yeah.
So there are things that you do have to avoid, challenge. It's exhausting.
I push that like a step further, because I've definitely experienced a lot of what you've mentioned. How do you know when to push and when not to? So, for example, when someone is clearly discriminating you, I suppose you can't fight every battle, but
no, you can't. It would be exhausting.
Not is the hill that we need to die on it.
Yeah, I think you have to let yourself off the hook and go, sometimes, you know what, sometimes I'll push too much and they'll just think, oh, she's a troublemaker and I'll just get informally blacklisted and that trust will never employ me. Unfortunate, that has happened. Sometimes you'll push too much. And other times you have to think, I'm too tired right now. Or maybe I could get in there and change it from the inside. And
We don't really want to be poster childs of like neurodiversity awareness. A lot of people just happen to have XYZ, but it doesn't mean they want to be, again, the poster person of.
Exactly. Yeah.
It's great that you are advocating, but I just wonder how many people going through similar experiences to you, but honestly just want a quiet, easy life.
Yeah. I think part of the reason that I'm advocating is so that those people could go through and maybe not struggle so much. But it greatly saddens me that my profession is now using both stats and driving as a massive gateway to training courses. So There's been people that have been excluded from being able to apply for certain training courses because they don't have a driver's license. Nothing to do with the amount of travel that's actually involved. I think I'm a sort of relic, really. I don't think somebody with my neurotype, as hard as it was for me, I don't necessarily think they would not manage to be a clinical psychologist now. There's so many, they're all doing these kind of stats tests and things beforehand, which actually, ironically, I'm generalizing, but an autistic person might be really good at. Different neurotypes might get in, but not my kind, which I think is really sad. So partly, I think, well, I'm doing it for people in the future. I'm doing it for that epileptic person who can't drive because the medication they're on. Why should they be not allowed to be a clinical psychologist? Ridiculous.
Yeah, there are definitely lots of roles. As you said, a professional person is often seen as a white person or a neurotypical person. That I think there are lots of roles that, even if it's not conscious, we don't actively seek out. Like the idea of being a doctor sounds like I would never be able to do that. Not because I don't have the brains, but because of the way they examine and the way they mark people just doesn't align with how my brain. And then you end up feeling dumb and stupid, and it lowers your self-esteem. So it seems to me that the biggest challenge with being neurodivergent is the kind of repercussions of a society that continuously rejects you.
Yeah. And I think that's where rejection sensitive dysphoria comes in. And I think you had a question about burnout. And I think it's no coincidence, is it, that so many neurodiverse people have so many stress-related health conditions. I see it all the time in my work. It overlaps with the gender diverse community as well. I myself have fibromyalgia, osteoarthritis, CFSME. I'm racking up the kind of stress.
You're just showing off now.
Yeah, absolutely. As if a few diagnostic acronyms weren't enough. But yeah, and I think a lifetime of masking and a bit of burnout and has contributed to those things. So I think we mustn't get sucked into a toxic positivity of kind of, oh, you can do anything. Because actually it comes at a cost. Facing down barriers all the time and challenging things comes at a cost. And sometimes you don't want to, and you just want to lie back or think, okay, that thing isn't for me. Maybe in 10 years' time, we'll recognize that it was exclusionary, but that isn't my battle right now.
No, I completely agree. And you have mentioned a lot about intersectionality and co-occurrence, how essentially it's not that you are collecting multiple things, it's that one thing means it's more likely to get another and another.
Yeah.
That kind of brings me nicely on to the next one around the perimenopause and how it interacts with ND, because I know you've mentioned to me this previously, and I'm very curious to understand, how do you manage or operate with so many different things going on when even in a clinical setting, fellow clinicians have very little understanding or data to understand what you're going through?
Yeah, there is. I think research is in its infancy in this, but I think perimenopause is a real spike for people getting diagnosed with neurodiversity that maybe they have managed to thus far mask. It's really affected my energy levels, and I think my life is very carefully calibrated because I've always, even before I was diagnosed with CFSME, I just thought it was, I'm neurodiverse and I just don't seem to have much energy. Before that, when I accepted the labels that were given to me, I just thought I was lazy or whatever, but it's affected my energy levels. So my needing to go, I don't have the time for that. I don't have the energy for that. That's increased. And therefore it's made it harder to mask as well, I think. And harder.
Was that when you were diagnosed? Can you remind me what ages you were diagnosed?
When I was young, I wasn't diagnosed as such. I was told I had clumsy child syndrome and I was put into special needs at school and told that I wouldn't
not officially
any qualifications. I think I was told backward, retarded, clumsy child, etc. It was partly because I didn't come from the sort of family that would do anything about that, really. And also we moved a lot. When I was in, I think, my late teen, I think I was 20 when I was originally diagnosed with dyslexia. I went and looked that up, did my own research, self-diagnosed with dyspraxia, and then got that sort of ratified much later on, along with all the various other things.
I asked that just because, as you said, a lot of observationally, I've seen a lot of neurodivergent women getting diagnosed as a result of going through the menopause.
Yeah.
Then essentially the masking, which they have built a lifetime of,
it falls apart because you're so tired.
These
and
are just we're only
Change our
just starting to talk about, really. As I said, there's not much data, there's not many studies.
No, and we maybe need we need more information on it really. But I think also there's something that goes on in your head when you get to the menopause or any sort of big life
Yeah.
stage where you think, is this all it is? This kind of, I've been conforming, I've been rounding off all my spikes for people for this long, and now I'm definitely in the latter half of my life, and I'm simply not prepared to do it anymore, not to the extent that I have done.
And rightly, you shouldn't have to. Suddenly, the weight of it just doesn't
Yeah.
seem as worth it anymore.
Yeah.
However, you're still working many years ahead of you. There's so many people who are probably younger than you who will just not have that level of empathy for a considerable time.
Yeah, and I think it's different because some people are really sympathetic about perimenopause who perhaps don't know anything about dyspraxia. So I could say, oh, I'm really tired because I'm perimenopausal. I might be really tired because of my neurodiversity. Oh, it's hard to separate out, but sometimes you use the
Yeah,
thing.
you use the more easier one. I'm the same with my dysgraphia because my handwriting is terrible. But I
Yeah.
was dyslexia, and I know it's not that, but it's just easier sometimes. And ultimately, these are what labels are for. They are to make life easier for people to have a starting point. So
Yeah.
I don't think there's anything necessarily wrong with it, but it is definitely better when people have more information, particularly when you're joining things together. Because
Yeah, interested. Like, why aren't people interested in dyspraxia? It really annoys me. I get so cross when I see things advertising for neurodivergent people, and then it'll say autistic underneath, and I'll think, oh, so you don't mean you just mean one neurotype. Yeah.
Or if you say dyspraxia and someone says, "Oh, don't you mean dyslexia?" You got it wrong.
Yeah. Yeah, as if you've got it wrong. Yeah. Yeah. And I think my dyslexia is possibly quite minor, but yeah, sometimes I will, like you said, I will use that if I'm not understanding something or having some difficulty with something. I'll go, it's because I'm dyslexic. And I think it's not, it's because I'm dyspraxic, but they won't know what I'm talking about.
Like when you talk about things like ADHD or autism, people very much accept that you operate and think in a different way. But when you think of things like all the Ds, dyslexia, dyscalculia, dysgraphia, people often think stupid and dumb, even if they don't say it overtly. And I'd love to know from your perspective, what can institutions do to stop undermining us? Because they do it every day, even if
Every
they
day, yeah.
aren't aware of it in the moment.
They can make information available in different forms. When I have an appointment somewhere or an interview somewhere or something, please don't assume that I drive. Please don't just provide a visual map because my brain can't decode that. So provided perhaps a descriptive one as well or something like that. So that will stop me feeling stupid even before I've got to the place where I'm having a job interview or I'm starting a course or whatever. I think to know that most neurodiverse people, if not probably all, have that inherent sensitivity. I've gone through my life being told I was stupid, lazy, and awkward, certainly for the first 25 years. So I'm quite criticism sensitive. I can go into a difficult old script. I don't really know the word triggered, but I could be triggered. We can all be quite easily triggered. Our educational experiences and our employment experiences are not usually that of a neurotypical person unless we've got very lucky. So bear in mind, we might be coming into something with already quite damaged self-esteem and expectations. So trying to build us up, have an interest in us. I think it's really why it's disappointing that there isn't, apart from this conversation about dyspraxia, I think it's really interesting. If somebody followed me for a week in my life and watched what I do, I'm not saying I'm the most interesting person, they would see the adaptations and the different ways that I do things. And it could really open a conversation about how everybody's brain works and that would have ramifications right across different neurotypes and different preferences and so on. So have a genuine kind of interest in people, what they find difficult, what they find easy. Or
it's not just an understanding, it's also an appreciation.
Mm.
I think maybe that could be really good in interviews as well, because let's say someone understands dyspraxia in terms of the clinical understanding.
Yeah.
Still doesn't put them in a good standing to get the role because you understand all the difficulties.
Yeah.
Only making you want to hire someone.
Yeah,
If
they don't understand your creativity or tenacity, your ability to see the world from a different angle, and they're not necessarily going to get all the positives, are they? And I think I'm not really aware of the positives. Sometimes I'll be telling people stuff about my life and they'll go, "Oh, you're amazing." And I think, no, I'm just did what I had to do to get by, which is also true.
It's a common thing that just because you are the person with the condition or type of brain functioning, that doesn't mean that you've been given the space or time to see the positives. I don't know anyone who hasn't been called dumb or stupid or felt that way who is neurodivergent through their adolescence. Unfortunately, it seems to go along with the
Yeah.
journey. And we normally don't give ourselves the space to think about the positives that this unique outlook has brought to the table.
Yeah. Yeah. And I think it makes me, this might sound like a bold claim, but I think it makes me better at understanding different forms of marginality. Really.
Hell yeah, it does.
I just think I get it sometimes with people who might be talking about a different experience, but I know more inherently what that feels like to be othered and to be having all these doubts about yourself and to be finding easy things hard and hard things easy and just not understanding why that is. And
I do want to talk about something that maybe is a bit more controversial, but I do think you are like one of the perfect people to tell us. I've definitely seen, we talked so much about comorbidity, which is having multiple things and they all interact with each other. When it does come to gender identity, there is definitely a overlap of sorts with neurodivergence and those who resonate with being, like, say, LGBTQ.
yeah, definitely.
I would
Yeah.
like to know your views and opinions on that because there isn't too much data that I could find that kind of backs this up. At the moment, it's just kind of observations. Like we know it's
Just correlation. Yeah, definitely. And there's some really difficult talk about autism in the gender diverse population. Almost the CAS report really blithely got filtered into public consciousness as actually these people are autistic, not gender diverse, and they don't understand who they are or whatever. And that's not, I don't think that's generally the case at all. But yeah, there is a much higher co-occurrence. My thoughts are it's got to be a kind of biological cluster, hasn't it? Just like you get more creativity with certain kinds of mental health stuff, it's just got to be something that sort of naturally comes together and overlaps. People much cleverer than me might want to look at the genes of it or not, or just think actually that money would be better spent on resourcing gender services properly, for instance. Yeah, there's a lot of, I really like that because people are coming in with all sorts of diverse identities and ways they identify. And there is that stereotype of kind of autistic people not knowing who they are. But I've found some of my autistic clientele have an incredibly nuanced, thought through, beautiful kind of knowledge of who they are. And I think when you don't fit in and you forcibly don't fit in, you can't fit in, you take yourself as a project, don't you? And you have to understand
100%.
why that is because there's a natural human need to try to fit in. And then you might discover all sorts of things about yourself and you might come to a very nuanced understanding. The other thing I want to say on that is like things like the gender binary or whatever. Is that perhaps a neurotypical concept or fancying people of the opposite sex or whatever? Is that a kind of a neurotypical concept that doesn't really
I would,
other people?
my personal views, and again, these are just my views, is that maybe there isn't a necessary biological link between neurodivergence and gender identity. But as you said, it's because we know we operate differently, so we are naturally more inquisitive in order to, and when you are seeking answers, you ask deep questions. So the questions on how do I resonate? What do I see myself as? How do I understand myself? Are naturally going to be coming up organically. When those who aren't neurodivergent, I think they are probably just as likely as anyone else to have any sort of different gender identities. But why poke the bear if it's currently going okay?
Well, I think there is that too. Yeah. Yeah.
Most things is probably a mixture of both.
Yeah.
It's very rarely one or the other.
Yeah. And it should never, ever be used to undermine somebody's experience of their gender identity or their sexuality or whatever. There's no, if anything, as we've said, neurodiverse folk know themselves better quite often.
It's interesting that you were mentioning that, oh, it'd be great if someone did some research on the genes and then you kind of like backtracked a bit. And I get it completely because I would be fascinated to understand.
I want to know, but I don't apologize. And there's so many ways money could be spent.
You can see why it's definitely controversial because you're like, who really cares? Ultimately, who really cares? I'm struggling right now. I need help now.
Yeah.
I think it doesn't have to be one or the other. You can definitely do multiple things at once. I
Yeah.
suppose it comes down to when there's limited budget, how are we helping people? And
Yeah.
there are most people that I know, for example, who are trans, I would say, whether they're diagnosed or not, they overlap with neurodivergent traits so heavily because
Yeah.
ultimately it's about thinking differently, not better, not worse, just
Mm,
differently. And people who have different gender identities to maybe the ones they were assigned at birth, to me,
mm.
they just think differently. And those differences can bring advantages in different scenarios, such as the workplace. There really isn't that much difference in many ways.
And
Now,
there's
here,
some
if we're going to get real
creativity.
controversial, and okay, hear me out, because in the DSM, the Diagnostical Statistical Manual of Mental Health Disorders, in the second version, being gay was seen as a disorder.
I
And
know.
obviously, no, it's not.
Not
Everyone
that long
agrees.
ago either. Yeah.
Yeah, most, I'd say most sensible people would agree it's not a disorder now.
Yes.
How divergent conditions still are considered as a disorder. And I wonder if, as our understanding grows, could we see that being taken out of the kind of statistical manuals?
Yeah. I'd like that. Yeah. Because I see it more as a difference, but then
But
I wouldn't.
we still need support as well.
Yeah,
But there
exactly. We
any
still need
support for
support.
being gay? No.
No,
Um,
probably
but
not usually.
society does discriminate against you. For
Yeah.
where it comes to saying have dyslexia, it is society that discriminates, but there also is an inherent challenge in certain tasks that are going to be unavoidable. So I think,
I noticed that I got, when I wasn't getting job interviews at all because of not driving, I started to get some when I would address it in the person spec directly and say things like, I do not drive because I have a recognised disability. However, I am prepared to use access to work, fund my own taxis, get public transport, fulfil the demands of the job. I believe this constitutes reasonable adjustment under the Equalities Act 2010. Suddenly I would get some job interviews. And it's, if I wasn't able to, ideally, I shouldn't be doing that because it shouldn't be in there. If I wasn't able to say, look, this is a disability in the society that we're in, and you need to sit up and take notice of that a little bit, then I would just be unemployed for a long time, as in fact I was. But yeah, yeah, I
terminology we use then, because for instance, we know that if you are black, if you're a woman, you do get more discriminated against than say,
mm,
a male counterpart, but you would never call, say, being black or a woman a disability. It is with just a change of terminology.
yeah,
Just
yeah,
because,
marginalised group, isn't it? It's yeah, it's a
yeah, there's still challenges involved with having certain aspects without it having to be something which is inherently wrong with you.
yeah, definitely. Yeah. And yeah, but it's hard that we only have that discourse to you. Yeah. Like I've have had to call upon the Equalities Act a number of times, and it's,
Yeah.
yeah,
And I
it
think
does.
that's a good reason why, on the other hand, we wouldn't want to take it out of circulation in
Yes.
terms of a disability, because it, at this moment in time, I think it is where it
Yeah.
needs to be. I
Yeah.
suppose what I was trying to get to is I don't see it necessarily always being in that kind of category.
I completely agree with you. And at some point, yeah, it would just be people have different neurotypes.
Yeah.
Like, I don't know, starting to accept a little bit that some people are owls and some people are larks in terms of their seemingly their biological clock or whatever. I still think larks get treated a lot better than owls, but it's, yeah, we need
Yeah.
to just accept that people are different and people have different preferences and different skills. And yeah, I'd like, yeah, it's a bit utopian at the moment. I would like it to come out of the realm of disability because that's kind of deficit and so on.
Now, me and you are both neurodivergent, and yet we are both professionals. Obviously, you are much more professional, which is great and considered of official recognition. But I am curious to get your views on the kind of balance between expert via experience and also professionally qualified. Does it give you a kind of unique understanding? Oh, Ilona, you still there? The question was, how has being both a service user and a clinician reshaped your understanding of power, trust, and therapeutic safety? Oh, it's just me now. It happens, folks. It happens. So while I'm waiting for them to rejoin, and I'll probably edit this out, maybe, I suppose there was a thing where, all we wanted was experts. Yet people, I think, felt quite disenfranchised and that they were talking from a very clinical perspective, which naturally they were, but it wasn't very empathetic. He was back. I was answering your question for you.
I was so interested in talking to you that I didn't notice the little icon that says you're running out of power.
Got cut off. Fine. Just to go back onto it. We talked a lot today about personal experience and how having lived experience can be beneficial. But I'm curious to know your views on the balance between having someone who is a regarded professional in the sense of qualifications, and then also someone who is expert by experience, and like understanding the difference between power, trust, and the safety that comes with different views.
Yeah, yeah, you've got to be quite careful about disclosure. I tend not to disclose about my mental health struggles. I might in a very guarded way if it feels appropriate, but you've got to be really careful about that because therapy is about that person. It's not about you as a clinician so much. But then you don't want to come over as that detached expert who's probably not even remotely understood what they're going through. So it's a judgment call. I'm quite lucky in gender because we have a lot of neurodiverse staff and clientele, and it's an okay place to disclose. Quite often I do share with clients. If I'm doing an assessment, I have to write down a lot at the time because otherwise my memory won't hold it. So I will just explain, and I don't always say dyspraxia. I sometimes say, I'm a bit dyslexic, so I have to write everything down because my short-term memory is a bit finished. And quite often the client will go, oh yeah, me too. So there's that. And sometimes I think when I was working in CMHTs, you see a lot of people quite clinical perfectionism and things like that. And actually it's quite nice for them to have a professional that isn't like that. Part of the problem with the sort of very limited demographics of people that get into clinical psychology is they're quite often very type A driven, motivated, able-bodied, very successful people with no neurodiversity or disability or not racially marginalized, whatever. And they're so detached. Some of the individual people are obviously great, but they're so detached from the everyday client experience. I think people they like the fact that they might see me on the bus, or I also went to a rubbish school. I also had abusive relationships. I've also been a mental health service user. They don't necessarily know that, but I think they do know on some level. I think they
probably just how you speak. They
get
that
exactly.
from you.
And I think I remember treating one woman once for clinical perfectionism, I guess, for want of a better word. And I was late for her appointment because I'd gone into a toilet. I'd gone into the disabled loo, actually, I think, or a loo that had some kind of adjustment. And I'd, by mistake, tucked this sort of thing into my pants that was part of a hoist thing.
Oh,
and
no.
The arms in the whole building. So I came and it was still time for her appointment. And these alarms were going off. And I was like, I will see you, but we need to sort this. So it was she was gently disabused of this notion that I'm the only one who gets things wrong here, or that means that you can't be a professional person. You can't, it's unforgivable to
Make you
all of yourself.
I agree. You know, most of the doctors I'm speaking to have actually been really lovely, but you can't help but feel a bit inferior because they seem to have their life together and you're your absolute worst. I think having someone who, as you said, if given in the right scenarios, maybe not all the time, but showing personal vulnerability can actually be very reassuring and calming and level the playing field between the two parties.
Yeah, I think so. And yeah, you have to be a bit careful about it. But I would point out that always it's a professional sort of persona, isn't it? And maybe that patient, maybe they work as a florist or whatever, and maybe if you go into their florist shop, they will come over as very expert about different types of irises or something, and you won't be thinking, oh gosh, this is someone whose mental health's really poor. They will have roles in their life where they're really competent and where not everything else is seeping through, and that's the same for me, but maybe a little bit seeps through always because that's part of your
and you can't stop being you. Now, is there like an element of like burnout with professionalism? So if you are expected to act in a certain way, I don't know how I would justify that to them, because on one hand, you do respect a certain professional approach from a clinician, but on the other hand, it is draining. Just me right now, just sitting up straight,
Yeah, I'm the same because I tend to snag and which is another thing people don't realize about dyspraxia. I think lifetime of like really poor posture because I've got no body awareness.
Oh, yeah.
Oh, I should be. Perimenopause made me very aware of the aches of having poor posture for a very long time. Professionalism, it's very double-edged, isn't it? And we've talked about how the expectation of a professional person is often quite a neurotypical expectation. Yeah, but sometimes clients, patients, whatever, sometimes they want to see you in a quite a professional way. I remember I generally don't buy any clothes that I need to iron because that's one of my life adjustments. I don't do ironing and I don't buy anything that needs to iron. I think at some point I'm in training or something, I had some kind of linen trousers. It was part of a sort of professional sort of look, but obviously I'd forgotten to iron them. So I go to get my patient from the waiting room and they go, "Oh, dress down Friday, is it?" And because I'm covered in creases and things like that. I find it's more managers and systems that want this kind of faceless professionalism that's particularly human or authentic. And I think clients and patients, and I'm deliberately using both terminology because I work in a kind of semi-medical setting now, so we might call people patients, but it's quite disrespectful perhaps to call a therapy client a patient. I think they generally, with some exceptions, want to see someone who's a bit more human, really.
No, I really appreciate that response. I honestly could chat to you for hours more, but obviously most things have to come to an end, all good things.
Yes.
I've got my last question to ask you, and this is hopefully ends on a more of a positive, forward-thinking note. And it's that if you could redesign clinical training through a neurodivergent lens, what three, or could be any number to be honest, non-functional reforms would you introduce tomorrow? So in a nutshell, from your experience being a neurodivergent person, what would you change to make things better?
Yes. I'd completely get rid of the requirement for driving. I would remove it from all person specs, all job descriptions. And instead, I would put in a description about what driving is involved. So there may be places where it might be a bit harder to do if you don't drive. And someone like me is perfectly within their rights to apply for that and then seek maybe access to work funding. I have to do such and such community visits over this geographical footprint. It is not fundamental to the role and it should not be used as part of selection because it's massively ableist. Similarly, I would do away with the sort of stats requirement. You probably do have to be quite good at stats to be a research clinical psychologist, but that's not very many people and they're free to pursue that path. Do you know what I mean? And I would do away with it being used as a kind of gateway thing because that is exclusionary. Non-negotiable reforms. And we need sort of part-time training options as well. So probably those.
Okay, so more flexibility, I suppose. Less kind of rigid requirements.
Less rigid requirements about things that really aren't a core of the role and come from.
That's pretty similar advice what I'd give in any business setting.
In any business,
the things you're requiring crucial.
Well, and is it really the case that if you don't put driving in here, you're going to be absolutely ambushed by tons of people who will get there and they'll go, "You mean me to get somewhere?" No, can do. That's very unlikely with competitive profession. It's quite unlikely anyway.
The benefit is that if we do make these changes, we're going to open up to a whole pool of new talent. When we know, for instance, places like the NHS are ridiculously understaffed, we need to gain more people in.
Exactly. Yeah. We need personnel that reflect our client base, really.
Yeah. It's what we started doing with like youth work now. And I think you got people who in yourself. And that's no longer a kind of obscure thing to see someone who looks like you doing community outreach roles. However, I would say in clinical professional roles, I still don't want to see myself in those that are treating me or supporting me.
Nor do I. And we should do because it should be on merit, not on kind of dubious handed down rubbish requirements that are exclusionary.
Yeah, thank you so much for that. I've honestly really enjoyed our conversation.
Yeah, I have too.
Being a bit all over the place, but and I think we've spoken from everything about personal struggles, different strengths, different how clinical settings should adjust. We talked about co-occurrence, comorbidity, and it's been really eye-opening and has definitely shown me helped me understand different elements of neurodiversity from a different perspective. So thank you so much for your time today.
Thank you.
I'm looking forward to staying in touch.
Yes, me too. Me too.
See you soon.